Let's turn to your work at the VA. You've said you want to make the VA the most transparent organization in government.
Yes.
Is lack of transparency really the VA's biggest problem?
Well, I do think it's one of our biggest problems. We have systemic issues that are big problems, but at the VA, we don't have a stock price, so I can't follow how we're doing. So my stock price is the trust that we have with our veterans, and we actually track that. And the only way I know how to regain the trust that we lost back in 2014 with our wait time crisis is to be transparent, to talk about the problems and to show the progress and areas that we still are struggling in. So we now publish all of our wait times for patients across the country. We're the only health system in the country that does that. We publish our satisfaction scores, our quality ratings. I publish our disciplinary actions every week on employees that we remove from service. And now I even publish my travel schedule because I believe that it's important to be transparent about issues that Americans are concerned about.
I noticed that. I noticed you even had visits with CBS News crew on your transparent schedule. Yeah. I know you mentioned, but since 2014, and this is, of course, the waitlist scandal that involved the VA hospital in Phoenix. Are wait times better since then?
We've done several things. When I came to the VA, there was no clinical priority system. So every veteran waited the same time, no matter if they had an urgent issue or an elective issue that they needed to be taken care of. And so now we prioritize our patients by clinical priority. So any patient that has an urgent issue can be seen. Every one of our VA medical centers has same-day services in primary care and mental health. And we're continuing to make progress and work on whittling down our wait times. In some parts of the country, it's tougher than others because it's hard to get healthcare professionals, particularly in rural areas. But I can tell you where I practice here in Manhattan, I work in the same-day clinic. And I can tell you that if there's a patient who needs to be seen here today, I am confident they will be seen on the same day.
The scandal at the time, which was exposed in Phoenix, was that you had hundreds, if not 1,000, veterans across the country who, while waiting for care, died. Unacceptable, right?
Of course.
Absolutely unacceptable.
Absolutely unacceptable.
You had Congress pass a $10 billion choice plan in response.
Yes.
So I have a simple question. Are the wait times better?
Yes, they are. And they're certainly better in Phoenix, but it doesn't mean that they're completely where we want them to be. We have a lot more work. We have 40,000 openings that we're trying to hire.
Vacancies, jobs to fill at the VA.
Jobs to fill. So we have a lot that we're still working on. And one of the reasons why I publish the wait times is to show those areas where we still have more work to do. But certainly we have made a lot of progress since 2014. And one of the reasons is working with Congress, this choice program. We now get patients that are waiting out into the community, into the private sector to be able to get the care that they need. And that's the system that I embrace, which is working to strengthen the VA at the same time while working with the private sector.
Part of the reason I wanted to sit down with you is because I've watched this issue since 2014, but the data is not entirely clear that the wait program has gotten better. I mean, let's get specific here. I mean, according to your own internal ranking system, Phoenix is still among the lowest quality VA hospitals in the United States.
Yes. Yes.
That's not better.
Well, let's break it down. When I first came to the VA, we had 57,000 patients who were waiting for urgent consults. Today, we would have less than a few hundred. So in the area of matching the clinical need of the patient to when they're being seen, we've made tremendous progress. And that's where we're focused, to make sure that we don't ever repeat where there are veterans waiting for care and are harmed by that wait. In the issue of Phoenix and the way that we measure quality, Phoenix, while it is definitely improving, and there are metrics to show that it's improving, has a long way to go. And this is a part of the country where we've seen such an influx of veterans due to retirement ages and people moving to that area. We've had trouble keeping up with it. We've opened up 2 major ambulatory centers around our major Phoenix Medical Center. And as those open up and as we're filling our positions there, we are going to continue to make progress. And things are improving there, but it still has a ways to go.